Thank you for joining us. I'm Brad Clunch.
And I'm Quin Tran. We continue with responsible distancing to bring you another episode of CNTV.
Like many families, we are scattered both near and far, yet we remain family, united together as Chickasaws.
Chickasaws joined Governor Bill Anatubby and other tribal leaders for the first Chickasaw virtual gathering. The event on June 25th gave Chickasaw citizens and employees an opportunity to connect with the tribe, get updates on commerce and health-related details, and other important information.
These are unusual times that require many adaptations to our normal way of doing things, and you probably have questions. We hope to address some of those subjects today, and if you still have questions, we would love to hear from you. After all, this gathering is about communication and connection, and that always works best when it is reciprocated.
Look for more virtual events held over the coming months on the tribe's Facebook page and website, chickasaw.net.
For the past 3 months, the Chickasaw Nation has had these COVID-19 test centers. They are drive-through test sites open to Chickasaws, employees, and the general public.
Testing and contact tracing are important tools for treating and tracking COVID-19. Dr. John Krueger explains how contact tracing works.
Contact tracing is really medical detective work. Essentially what we do is if a person is deemed to be infected with an infection, we contact that person and then ask them to think of anyone they might have come in close contact with. Then that allows us to reach out to the people they might have been in close contact with and see if they might also have infection as well.
Why is contact tracing valuable at this point, especially with this particular disease, with this coronavirus?
You know, contact tracing's been around for a long time. Since really one of the first times that contact tracing was used was in 1854, when John Snow, who was in London, England, there was a large cholera outbreak that killed about 500 people in several weeks' time. And John Snow was a physician in the community. He was a general practitioner and surgeon. And at the time, the theory was that cholera spread through the air. Cholera is one of the most deadly diseases in the world, and in the history of the world has probably killed more people than any other disease. What Snow was able to deduce basically was he took the patients that passed away and he took a map and he drew a dot for each house where there had been deaths, and he deduced that his theory was that it was coming from contaminated water. Today, modern day contact tracing is really about contacting, typically by telephone, sometimes in person, people that you might have been in close contact for, especially with a respiratory pathogen that we're dealing with in COVID. And so we take that respiratory pathogen theory that it travels through the air. Were you in contact with somebody, under 6 feet, or somebody that had active symptoms, people you live with, people you work with, et cetera? And can we have you think back and recreate where you were over the last, 4 to 14 day period, essentially? Then we would reach out to those people, offer them either testing typically, or ask if they're symptomatic or showing any signs of COVID. You can isolate then those folks to keep them from going out to the broader community. And that's one way you can stop an infection from spreading.
At the Chickasaw Nation, there is a team that does the contact tracing. Is that right?
Yes, Quin. So this was really an exciting development for us since we last spoke. So we have actually trained a team of contact tracers that work for Chickasaw Nation. I believe we're one of the only tribal health systems in the nation that does this, and it's through our Department of Public Health here. Typically what would happen if a person came through one of our testing centers or a hospital or health system, any of our clinics, and tested positive, then we would start that initial outreach. But any positive that we get back, triggers several responses typically from our health system. The first thing that happens is that you'll have some outreach call either from our lab or from a clinician that will call you to make sure you're feeling okay and also notify you that you've had a positive test result, because we want to act very quickly so that person doesn't continue to go out in the population. One of the second things that happens pretty closely after that is that a member of the contact tracing team will contact that person and then ask for their permission to conduct an interview, a contact tracing interview with them. So they will ask some of the same questions that the physician did again, or the lab did again. But then they will also go on to ask about the close contacts and try to understand who that person where they might have traveled to, who they might have come in contact with. Was it a high-risk contact? And there's a methodology they use to determine if it's high-risk or low-risk contact. And then after they have the names of those folks, they'll start the other part of the investigation, which is to reach out to those other networks and determine if we want to invite those people for testing or just have them isolate at home. Thankfully, we've been able to reduce that spread very significantly through what we believe are a lot of the public health measures that were put in place earlier on.
How would you assure people that everything is done in confidence, that it is private and there is privacy to this process?
Absolutely. So we, again, whenever we do contact tracing, typically we don't tell you who you were exposed to. Sometimes it's pretty obvious because the family member has told their other family members, but when a contact tracer calls you, what they will say is that you've been exposed to somebody, and then they want you to kind of think through your network. So again, the focus is still pretty much on what you know about who you were with and where you were around, and it relies on the confidence of people. And because of that, as well as because of HIPAA, we do keep your information, we keep your information protected. And so we don't share this person's affected or that person's affected.
Let's talk a little bit about testing underway now. What is the latest that you can share, Dr. Krueger?
Our COVID-19 testing to date, we've tested roughly 16,000 individuals at our CNDH testing facilities. A lot of our testing is now focused on testing our employees as they get ready to reopen. And then we'll continue to do ongoing surveillance with our employee population so that we know if our mitigation strategies to prevent people from getting ill in our workplace are effective. That's very helpful to us to be able to evaluate our mitigation strategies that we have in place. And if we need to, we can change things to help make our workplace safer. If there are outbreaks, we can rapidly identify them, respond, again, isolate those individuals, contact trace them and their close contacts, and not only protect our workplace, but protect our communities in which we live and work.
In upcoming episodes of CNTV, we'll explore more topics related to the coronavirus, including serology or antibody testing.
For more information on COVID-19 test sites and other questions, contact the Chickasaw Nation's COVID-19 hotline. The number is on your screen. The Chickasaw Nation WIC, Women, Infants, and Children program, launches a new application service online. All eligible mothers, both native and non-native, may apply for WIC services by going to chickasaw.net/WIC. After submitting the application, a WIC staff member will be in touch. The WIC program offers nutrition information, resources, and counseling to families. Tax Day is July 15th. The Chickasaw Nation Volunteer Income Tax Assistance Program is offering tax preparation help to qualifying individuals and families at no charge. Get more details at chickasaw.net or call the number on your screen. The Artesian Arts Festival is a favorite for many of us who enjoy the work of Native artists.
Because of COVID-19, the festival was canceled, but Native artists are showcasing their work online. The Chickasaw Nation is hosting this website, artesianartsfestival.com. It features the talents of Chickasaw and Southeastern artists. The artists may display up to 5 pieces of art, works of arts that may be purchased online.
So you can go on the site and you can click shop and you can click on availability. And once you click on availability, it'll show, the art, and it'll also show what has already sold too. So you're still seeing things, for a while that's already been sold. And then if they sell a piece, then artists can also submit something else and be added. So it's always being updated.
Visit artesianartsfestival.com often between now and July 31st. July 31st is the last day of the Artesian online art market. People may browse the website by category or by artists. More than 50 artists are featured on the Artesian online art market.
Many talented people are featured there. Well, we've enjoyed bringing you this episode of CNTV. Quinn and I will see you back here soon.